right, today's video is going to be about who is eligible for Medicare. That's a question we get all the time. And just to start off with, right out the gate, not to get too sidetracked, right? We're talking about Medicare, which is often confused with Medicaid. Two separate deals. Medicare, federal, national program, whole United States, same program, came out in 1965. Medicaid is an income-based system that's ran by each individual state. Kansas, it's CanCare. Tennessee is TennCare. You know, up in like Badger Care up in the north, right? But and sometimes it's just Medicaid. But we're here to talk about Medicare for those. Most people get it by turning 65, but there's other options, and that's what we're going to talk about. So there are basically 4 different options when you're looking at how do I get into Medicare. Option 1 is you're turning 65. Option 2 is you are over 65, but you've been working and you've had coverage through your employer, which was deemed credible. General rule of thumb, most employer coverage is credible nowadays because it kind of has to be for them to offer it, but you have to check on that to make sure that it is, but as long as you're going to keep going. So option 1, turning 65. Option 2, I'm leaving my employer coverage now and I'm over the age of 65, and now I need to get on Medicare. Option 3 is I've had a disability and now I am permanently disabled. There's an option to get on Medicare through that direction. And then option 4 is I am retiring from the military and I'm getting into like TRICARE as an example. So there's a couple different ways. Now let's break these down into each number. So number 1, I'm turning 65. That's the most common way that people get into Medicare. So when you're turning 65, what's going to happen is whatever your birthday is, that's going to make your Medicare effective date. So as long as you're a U.S. citizen, you've worked 40 quarters, or your spouse has worked 40 quarters, that qualifies you for Medicare Part A at no, quote, cost. I say quote because you've paid taxes your whole life. So keep in mind, it's not a free program, it's an earned benefit, but that's how you qualify for it. If you have not worked 40 quarters and your spouse didn't work 40 quarters, there's going to be some additional cost for Medicare Part A and potentially Medicare Part B. We've got another video you can check out, MedicareWithJake.com, and you can watch all the videos about that specific topic on there. So let's say you've worked 40 quarters, you're turning 65, what do I do, right? So at that point, it used to be pretty automatic, but now it depends. Are you drawing Social Security? Are you not drawing Social Security? Some people turn 62 and start drawing Social Security. Some want to wait until their full retirement age of 66 and a half or whatever that age is for them. It keeps it's going to be climbing as age-ins become a little bit older and move down the line. So you typically, as of right now, filming this, you want to let Medicare essentially know that you want to turn on Part A and you want to turn on Part B, if that's the route we're going to go down, about 3 months in advance. That's a pretty safe estimate. You know, there's about 10,000 people per day turning 65, so you really don't want to wait till the month of or the month before. So when I talked about your birthday, let's say you're born in the month of June, from June 2nd all the way through the end of the month, then your effective date for Medicare on your 65th birthday will be June the 1st. The exception to that is if you're born on the 1st of the month. If you were born, as an example, on June the 1st, now instead of June 1 being your effective date, it goes back to May 1st. If you're born on May 1st, again, that goes through on every single month. So most people will have it be effective the 1st of the month they were born, unless you're born on the 1st. So that's important to note. And then you can work back 3 months from there. You can actually call us at 833-NOW-JAKE, and we will help you walk through this and how to do it. Because what's interesting is Medicare, when you call Medicare, who you would think would help you set up Medicare, right? It makes sense that they're overdoing it, that they would be the ones to do that. But that's not really how it works. So it gets really confusing. To set up Medicare, you actually do that through Social Security. Now, in the times that we're in right now, Some offices have shut down. I've heard they're reopening them. I don't know if that's nationwide, at least in our area they have, but limited availability, by appointment. You can't just walk into your Social Security office and set it up like you could 4 or 5 years ago. That may change in the future. They may keep running this model. I don't know. It depends on what happens with COVID and all the different things. But you can set it up online at ssa.gov. You can also set it up over the phone with Social Security. Call us and we can help you with some of the local numbers for your local Social Security office, because there's a main 800 number, and then there's also 800 numbers that ring into, like, for example, Wichita, Kansas, and whatever city you're in have those. So usually the ones that are local have a lot less wait time, and you're dealing with somebody that's local, somebody that lives there. So that's always kind of cool. But it's interesting to know, you need to know that you've got, once you get it set up, you get into your initial enrollment, and you can sign up 3 months prior to Medicare coming effective. You can sign up the month of, and you can sign up 3 months after. Now, we don't see much of people signing up for the after, because then what are you doing for health insurance, right? Once you qualify for Medicare, you don't qualify for the ACA, Affordable Care Act insurance, and you know what I mean? And a lot of times it's more cost effective to go on Medicare than it is other things. So typically we're seeing somebody 3 months prior to 65 going, okay, I'm calling Social Security. I'm telling them what I want. I want Medicare A, I want Medicare B. I do not want Social Security, or I do want Social Security. That's a whole nother conversation on how and when to take that. And then they're getting that set up. They're meeting with somebody like us over the phone, over Zoom, over, you know, however you choose to do it, in person, whatever the situation is, and we're walking through options and plans, educating you on what your options are, so you've got a plan in place come that time. So that's the turning 65, without super overcomplicating it.